Are you wondering which vitamins, minerals, nutrients, or medications you should be taking prior to your blood test and which ones you should be avoiding? My name is Dr. Taranella, and in this video, we're going to look specifically at this question, taking vitamins and blood testing, what you should avoid, what you should take. Now for a quick disclaimer. All right, let's jump into it. I had several questions about this on the channel and from patients about this as well. Questions like, I'm on thyroid medication. Should I take the medication before my blood test? Or should I take vitamin B12 on the day of my blood test? So I'll break down some specific things and also some general ways to look at this. First, some general things. So when we're testing to see the impact of ongoing therapy that is being used to replace something in your body, you do want to take the substance before your blood test. A good example of this is something like thyroid replacement therapy or hormone replacement therapy. You want to take these when you get the blood test to see how it is working in your body, how the levels look in your blood. Some people get confused with this and say the levels are high because I took it. And my response to this is, if it's high when you took it, we want to know that it's high so that we can make adjustments. It's not simply high because you're testing your blood. This is how it looks every single day. Now, of course, you can take your blood at different time intervals to get an idea of what the peak and the trough levels are, but you will want to avoid the replacement therapy simply because you're checking your blood. The opposite scenario occurs when you're trying to build up a substance in your body or replete the levels of something in your body that's deficient. So your zinc is low or your vitamin B12 is low, and you're trying to build those levels up in your body so that it's no longer deficient. In this case, you do want to avoid the spike that comes from taking the vitamin, mineral, or nutrient right before the test. So in these cases, you would avoid it for 1 to 2 days prior to the test. And then the last tip I wanted to give is on interfering factors. The main one being biotin. Biotin will interfere with many blood-based tests that use immunoassay technique to test and identify your levels of a certain substance. This is one of the most common blood test methodologies used, and that's why it's easier just to avoid taking the biotin in the set amount of time rather than thinking through whether or not the test that you're going to take is going to be affected by it. So you should usually avoid biotin for at least 3 days and possibly as much as 5 days leading up to the test. If you're taking really huge doses, like several milligram doses of biotin, then 5 days for sure, possibly even more. All right, that's all I had on this quick tip on taking vitamins and blood testing. If you do have questions about this topic, drop it in the comment section. Happy to answer your question. Thanks again for watching. We'll see you next time.